everybody. Today I'm going to talk about something that most of you are probably familiar with. It comes along with body aches, cough, fever, nose congestion, and that is, those are just a few symptoms of the influenza virus. I'm sure most of you guys have had the flu and struggled with the symptoms that come along with it. Today I'm going to discuss the flu of 1918, where it originated from, how it affected the world, and also ways to protect yourself. The flu of 1918 was an extremely deadly pandemic. According to the CDCF, more than 3.5 million people each year are seen in the hospital for flu-related problems. Approximately 3,000 to 49,000 people die each year in the U.S. alone from the flu. First, I would like to discuss how the flu spread across the world. The first strain that we got wasn't as bad. It was just a cold, kind of like a cold, and not a lot of people, actually nobody was dying from it. But then that first strain turned into a second strain. It mutated, actually mutated from Europe. It created a 24-hour death rate, so people were going into the hospital and then dying within 24 hours of being there. Although there's not a universal consensus of where the flu originated, some people think it's Spain, and that's why it's nicknamed the Spanish flu, if you guys have ever heard that. The first known person to get it was actually an army cook out of the United States. His name was Albert Gitchell, and he had 104.7 degree fever, and that was kind of his first symptom from the flu. James Harris, an historian at Ohio State University, talked about how the rapid movement of soldiers throughout the world was creating this virus to spread quicker. According to History.com, the virus infected 500 million people worldwide and killed an estimated 20 to 50 million people. That's more than all the soldiers and civilians killed during World War I combined. Charles River, he wrote the 1918 Spanish flu pandemic, said this: "However, as bad as things were, the worst was yet to come. For germs would kill more people than bullets. By the time the last fever broke and the last quarantine sign came down, the world had lost a huge amount of their population." So it started in the beginning of 1918, and then September and November, it was just running, crazy. It was just going crazy. Everyone had it. They had a thing, I want to show you guys one of my visual aids. It was called a W curve, and that's kind of the way that it spread, if you guys can see this. On the side here is the death rate, and the bottom is the age group. Over here, it says how many, the death rate, and then on the bottom, obviously, is the age, and it shows it's in a W curve. So the highest was 1 to 4-year-olds. Then it would drop down from 5 to 14. They wouldn't have as many victims die from the flu. And the weird part about this, and what everyone thought was just so weird, is that it peaked up over by the 25 to 34. Like most healthy people, 25 to 34, they're young, they're healthy, they don't have a lot of issues most of the time. And it peaked up, and then it comes back down, and then it goes up when it gets over to the 65 to 84 range. So this was my visual aid to show the W curve. And a really cool story I have for you guys is my great-great-grandma was actually a survivor of the flu of 1918, and her husband at the time and 4 kids all passed away, and she ended up remarrying my great-great-grandpa, and the rest is history. So I thought that was a really cool story. And before I even picked this, or I had already picked this, and my grandma actually called me and told me this. So I thought that was a really cool thing. It kind of worked out. So people were obviously dying from this. They were stuck with blistering fevers, nasal hemorrhaging, pneumonia. They felt like they were drowning. A physician at Camp Devens Hospital reported that hours after patients admitted, they began to turn blue. It was a matter of time. He said this: it was a matter of hours until death came to them. So it was definitely a very horrific, flu problem. Partially to blame was the health officials unwilling to impose quarantines during wartime. They didn't want to leave areas unmanned, ships unmanned, so they didn't quarantine soldiers. There was no vaccine for the virus because microscopes couldn't even see anything that small until 1930. So they had a good 11 years before they could even see what the virus was. Now that we know how the virus is spread, I'm going to turn over to talk about what the flu is and who's most at risk, even nowadays. According to Mayo Clinic, influenza is a viral infection that attacks your respiratory system, nose, throat, and lungs. So who's at most risk? Obviously, most risk would be the 2 to 4 range nowadays, and then also the 65 and older. Diseases that increase your chances, obviously if you have pre-existing conditions, diabetes, obesity, heart disease, you're gonna be more at risk to get this flu, just like any virus or any sickness. The symptoms, some people get the cold, which is, it kind of mimics the flu, but the flu is way worse. You're gonna have more fever, more body aches, more chills, kind of just lethargic and tired. According to the Mayo Clinic and CDC, you should seek medical attention 3 to 4 days after all of these symptoms, like they're not getting better at all. Now that we've talked about what the flu is and where it originated from, I wanted to talk about some helpful hints to protect yourself. Proper hygiene is like number one, and in my opinion, I don't think that a lot of people practice proper hygiene. Hand washing is like a huge deal. And I actually have a visual aid, and it's probably repetitive for some people, but I thought it was a really good visual aid to explain how to wash your hands. So obviously it just says wet your hands with water, put soap on them, palm to palm, like interlace your fingers, get everywhere. Another really good tip it said is that when you turn on the faucet, you should be using a paper towel. When you turn it off, you should be using a paper towel. Also, when you leave wherever you're at, you should be grabbing the handle with a paper towel, because that's a lot of people grab that before they wash their hands or before they, when they come in the bathroom. So that was a big thing too. The CDC encourages people not to touch their nose, mouth, or eyes because it can be transmitted into your body. That's the way it gets in. Obviously, vaccines are a huge thing. Each year, the scientists and doctors, they work together. They inject it into people's bloodstreams, and it activates a certain immune response to learn how to fight the virus. So I know vaccines are a touchy subject. Some people don't get vaccines, and that's totally fine, but the CDC recommends if you want to avoid getting the flu shot will help. Today I discussed where the flu originated from, the symptoms, and how to better protect yourself from it. Obviously, there's a lot going on in our world, and I wanted to share this information with you guys about another global pandemic, and maybe we can learn from it. Thank you guys so much.